Hello everyone, I'm Jim Daly from Daly Manufacturing, and I'm glad to be with you again this month. This is May 2nd, 2018, so I know some of you may be watching this from overseas. It may be May 3rd where you are, but right here, right now, it's May 2nd, and we're happy to tell you about our new topic this month, vitamin D. But first we're going to talk about a few new products as well. I may have mentioned this last month, but we have flax oil liquid now. So this makes a great salad oil, light cooking oil. You don't want to heat it too much because you'll damage the unsaturated fatty acids in it. But you know, if you're boiling a stew or something and want to put it in it, it'll usually hold up to that, but don't fry with it. But this is a wonderful source of omega-3 fatty acids from plants. So it's something I hope you will like. We tried having this years ago and couldn't sell it fast enough, to be honest. That was, I think, almost 25 years ago. I think now it's going to go better because there's a lot more interest in the omega-3 fats than there were back then even. Also, let me show you something else I showed you before, our new water bottles. I'm getting a lot of use out of this personally. Now, and I know a lot of people that work for us here are as well. So this is made to tell you how much water you're drinking through the day in 4-ounce increments. It's a very good way to drink water properly as recommended by Dr. Carrie Reams. And it's a very useful tool for your health. If you drink your water right, your supplements are going to work better as well. Finally, this is out, Ageless Brain. And this is based on the information that I gave you in our February talk, I believe. You can go on to our YouTube channel. Just go to YouTube and search for the Daly Manufacturing channel and you'll find us there. We have 3 videos on there right now, and we'll have this one up very soon. So be sure and go look for that information on brain health. It's a lot of very good recent research that's been coming out on how nutrients can protect your brain throughout your lifespan. And this is based on all of that research. Now, we'll get to our talk in just a minute, but right now I'm going to take a real quick break, get some of that good water, and then I'll be right back. Okay, I'm back. Now, today we're going to talk about vitamin D and how it can work for you, how it may not be working for you, and how you can make it work for you. Because vitamin D is a difficult nutrient for many people. In fact, my doctor told me that even though I'm taking 5,000 IUs a day, I'm still just barely in the good range. And a lot of people are like that. In fact, a lot of people are taking vitamin D supplements and are not in the good range. They're still deficient. So we're going to talk about why that might be and how we can avoid it. So the title of the day is, Daily News, Vitamin D, Making Vitamin D Work for You, and why you may spend time in the sun, take vitamin D, do all these things right, and still have insufficient vitamin D levels. Well, we all know that vitamin D is a sunlight vitamin, right? I mean, that's something that everybody knows. And it is a way of getting vitamin D, no question about it. The vitamin D reacts with cholesterol in the skin and makes vitamin D. And that goes into circulation. So this baby should have plenty of vitamin D, and it probably does. That young, soft skin will make vitamin D very well. So that baby probably has plenty. It's getting the exposure and everything. However, we have ways of defeating nature. And we're good at that sometimes. And sometimes we just, just the way we are defeats it a little bit. But this guy here, you see, we're getting in right now in North Carolina, we're getting into the time to go to the beach time of year. And so everybody wants to go out to the beach. A lot of people are laying out in the sun trying to get suntans. I used to do that when I was younger. Honestly, it's not a good idea. You don't want to really cook your skin because there is a risk factor there for melanoma, and that's a very serious type of cancer. So, but you see he's getting a good tan. Also, he's putting on a bunch of sunscreen. Sunscreen blocks vitamin D manufacture in the skin. It just won't do it because it needs those UV rays to penetrate the skin to where the cholesterol is to make that chemical reaction to convert vitamin D convert cholesterol to vitamin D. Now this girl is out in the sun too, and she probably doesn't have any of that sun blocker on. However, she's got another problem. She was born with very dark skin with lots of melanin. She's going to have to be out there a lot longer than a lighter skinned person to get the vitamin D because her body has adjusted to be able to be in the sun, not get burned, but also it won't be able to make vitamin D as fast. So, there's a lot of pitfalls that we just start out with. And I'm not really telling you if you're light skinned not to use sunblock because you don't want to be getting melanoma, and that is a risk factor. So I'll just put it out there. It really is. However, it's good to get some sun exposure without the sun blocker, but you don't want to burn your skin because that puts you at real risk. Now let's talk about vitamin D and vitamin D metabolism a little bit. Of course, like I said, vitamin D is synthesized from cholesterol in the skin. And then you can see that the UV light reacts with the cholesterol to make cholecalciferol, which is vitamin D, which then goes to the liver and is converted to 25-hydroxy cholecalciferol or vitamin D. Also, we can get it from dietary sources, and it's absorbed in the gut and goes through the same pathway here. So 2 ways of getting vitamin D. Also, there are 2 types of vitamin D that we sometimes get as supplements or in foods. One is vitamin D2. We get that from mushrooms that have been exposed to sunlight. They actually produce the vitamin D2. Also, we can get it from fortified milk. They usually use vitamin D2 form in milk because it's the least expensive form of vitamin D. So that's the form they use. And then from supplements, there are supplements made with vitamin D2, and you can buy those. Actually, we used to have a vitamin D2 supplement. Years ago, I saw an order blank. We haven't been making it lately because vitamin D3 is much more active in the body. Now, vitamin D3 is the one we get from sunlight. That's the one your body makes. Also, some foods have a little bit of it in there. Some meats and fishes have vitamin D3. And then supplements, like the daily vitamin D supplements or vitamin D3. So, why might somebody want vitamin D2? Because we've learned that you have to take about twice as much vitamin D2 to get the same activity in the body as vitamin D3. So if you take 1,000 IUs of vitamin D3, you would need twice that much of D2 to get the same effect. But it is vegan, and for some people that's very important. It's from plant sources. Now let's go back to D3 a minute. Where do we get that? Well, the daily vitamin D3 is almost vegetarian or vegan. It actually comes from lanolin, which it comes from the wool of sheep. Now that wool has an oil in it, and so they don't hurt the sheep. When they shear it, they treat it to get that oil out that has the cholesterol in it. Then they take it and expose it to UV light and make cholesterol. And that's how we get the daily vitamin D, the D3. It's from irradiated or UV exposed lanolin. And it's a very good source. It's a very high quality D. We have ours from a source in Israel, and it's coated to protect it so it doesn't degrade as well. So it's probably, in my opinion, the best out there. We have had several vitamin D sources and haven't been quite as happy with any of the others, honestly, because some of them just didn't hold up very long with shelf life. This seems to do very well. We've been testing it, and it's holding up. That coating, I think, is what makes the difference that they use. It's kind of a microbeadlet. Now, so you have your two types. If somebody is really hardcore vegan, however, because it doesn't come from a plant source, it does come from an animal source, they may not want it. And in that case, they'll need to use the D2. That's kind of, the analogy I like to make with people is getting the vitamin D from lanolin is kind of like using honey from bees. They're neither of those do you eat the animal, but they both are produced by the animal. So if you're a very strict vegan that won't even eat honey, you may not want to eat, use our vitamin D3. And if there's enough of you out there, let us know. We can always make a D2 if we need to. We would just recommend taking a lot more of it than you do of the D3. But very few people object to the D3 coming from lanolin. So far, we're not making a D2, but it is an option if we get requests for it. Well, let's move on. How about the sunlight as a source of vitamin D? There are some pitfalls there, and we'll cover this now, and then we'll probably come back to it a little bit later. Okay, we know that we get sunlight from vitamin D from sunlight. In fact, you can get a lot from sunlight. People who work on the beach as lifeguards during the summer have very good vitamin D levels, actually. But they're out there in the sun all day, 5 or 6 days a week. So they get a lot of exposure. And the people have told me that are doing the real vitamin D research at some of the scientific meetings that to get the equivalent vitamin D levels that they're getting in the sun during the summer, they'd probably have to take about 15 to 20,000 IUs per day of vitamin D supplement. So that's how much they're getting from the sun. So it is possible to get it from the sun. But these are young people, remember, too. Their skin hasn't aged much yet. But things that would impair it, dark skin, like I mentioned earlier. That slows down that production because not as much of that UV light gets through. So you have to have more of it. Sunscreen, sunblocker, that impairs the vitamin D production. Not enough high intensity sunlight exposure. During the winter, you can get out in the sun and not get any vitamin D because the sun intensity isn't there. There's an actual threshold for intensity of sunlight where it starts to make that reaction happen, and it just doesn't do it in the winter. Here in North Carolina, we probably get enough high intensity sunlight in the afternoons from about April to about October, somewhere in there, to be able to make vitamin D. You get further north, up in Minnesota, you're going to shrink that down by a couple of months. You go on up to Alaska, and you're going to really have a hard time making vitamin D any time of year. So it really has to be pretty intense sunlight. Excess fat, and we'll mention that again too. This is a real problem because it appears that when your body makes vitamin D in the skin, a lot of it never makes it into circulation. It gets stored in that fat, and it just doesn't get where it needs to go. Also, the fat may be blocking acting as a sunblock itself, not getting quite deep. It's a little bit of a layer right there where it shouldn't be, perhaps. I don't know. But very, very good research to show that excess fat really hampers your vitamin D production in the skin. Also, it hurts absorption of vitamin D apparently from supplements. I'll throw that out because we'll mention it again. So it's doing a couple of things there. But you know, fat is the enemy of vitamin D. Let me put it that way. Air pollution. If you're in a heavily polluted area, major city with a lot of smog, you're not going to get the sunlight intensity during the summer or any other time to make vitamin D. And then age. As your skin gets older, the proteins change. You'll notice that your skin, you know how leather ages if you have a car with real leather seats and dashboard, how it gets dry and hard and crackly as it gets old. Well, your skin does kind of the same thing, and it no longer transmits that UV light like it should. It just doesn't work. So it's sort of equivalent to having dark skin to start with. So age really impairs your vitamin D production as well. So why is vitamin D important? And we'll just go over a few things about that. And everybody knows it's important, and everybody says, well, bones. That's what people think about. Calcium and bones. But there's other things too. But like I said, vitamin D is not just for bones. It's critical for muscle contraction. It's the signal from the muscle cells to contract and relax, contract and relax. It's all vitamin D that does that. Well, it's all calcium that's controlled by vitamin D. The levels of it in there are. So that's very important. Blood levels of vitamin D are tightly controlled. But when calcium gets level, your parathyroid hormone goes up and more calcium goes in. So that acts in a lot of places. Your smooth muscle cells too, not just your muscles for exercising. Vitamin D, we talked about last year, is really important for the smooth muscle cells of the vascular system, and it's important for maintaining the correct blood pressure. So lots of things that it's doing. And there again, why is it important? Well, it's important in the brain, in the respiratory tract. It acts in the circulatory system, as we mentioned, in the pancreas. It's really a critical factor in diabetes, as we'll talk about in a minute. Muscles, bone. So it seems like almost the whole body is involved with vitamin D. But how much do we need? And that's always a good question. And people debate this. But this is a pretty good breakdown. Now, you'll notice, I want to do one explanation here, that we have two different ways of doing it. When you get your reports from a doctor, it'll almost be always be this top one, nanograms per milliliter. Okay, that's what you'll see in a report from a doctor. If you read scientific studies, they'll report it in what you call SI units, and that is 75 nanomoles per liter. So what they're saying here, anything below 30 nanograms per milliliter, if you get a report back and it's 28, you're deficient. Or 75 nanomoles per liter is what the scientific literature will say. And they're the same amounts. It's just a different way of expressing it. And that really gets confusing to people. So I tried to make it clear. And you might, if you really look at the scientific literature, you might want to actually print off this slide if you're watching it on the internet, because that will keep you kind of on track of what you're looking at. So insufficient, they're saying, but most people will tell you that anything above 30 is in normal range until you get very high. That's what your doctor will almost always tell you. But most scientists will tell you that, yeah, 30 is sort of okay, but you really ought to have a little bit more. And so this slide says that 30 to 50 nanograms per milliliter is, insufficient but not deficient. It's sort of just barely okay. And that's where I am actually after taking 5,000 IUs a day for months, just to tell you. Optimal 50 to 70 nanograms per milliliter. That's a pretty good bit in your blood. That's just really very nice, and we'll show you some results from some studies in a little bit that really bear that out. That's really where you would like to be. If you're going up 50 to 100, well, they're saying here that that's more of a therapeutic dose for somebody with cancer or heart disease. Okay, maybe. That's certainly safe range, but it's on the high end of safe. And then over 100 nanograms per milliliter, that's getting to be an excessive amount. And you don't find people up that high very often. It's pretty rare. But it's possible. It does happen. So those are the levels you want to look at. Essentially, you want to be in this block here. So 30 to 70 nanograms per milliliter when you get your report back to from your doctor, with the higher end of that being better. And you're okay and doing very well if you're there. In fact, if you're at 30, you're better than probably half the people in the country, to be honest. I know I was talking to a scientist I worked with in Korea about this, and she says almost nobody in Korea is above that. So Koreans like light skin. That's a thing with Asians. They take skin whiteners. They really like white skins. All the women I know of going around with these big baldwin brim hats when it's sunny outside. They put on sunblock all day long. So what can you say? They're not going to get anything from sun doing all of that. So they're almost all low in vitamin D. And they really need to be supplementing, if they're going to do that. Well, let's just talk about a few things that really point out the importance of vitamin D. Patients in this study were given 3 milligrams, that's 180,000 IUs of vitamin D, for one time every 3 months. So they were giving them very large doses, but only 4 times a year. That would be equivalent to about 2,000 IUs per day, so it's not really a real high dose, honestly. And after 1 year and 4 years, survival times were greatly improved in the supplemented group. So that was interesting. It also prevented osteoporosis and hip fractures in that study. So that's back to our bone strength and things like that we've always known vitamin D is good for. Also, I won't get into this because it's a really long, detailed review article about vitamin D and autism spectrum disorder. And it's a very lengthy article, but they have some really strong evidence supporting a link between poor vitamin D status and autism in children. So that was very interesting. However, what they did not have is a prospective study supplementing vitamin D. There wasn't much in that to show that it will reverse it. So I can't tell you right now that if somebody has autism, giving them vitamin D will reverse that or not, because that study hasn't really been done. But it seems to be linked to causing autism at least. The studies just haven't been done to see if it will reverse it yet. It might, and it might not. We don't know until those studies are done. So that's just sort of a gap in the research. Also, this was a trial looking at cancer rates, breast cancer and other cancers in older women. It's a randomized clinical trial that was published in the Journal of the American Medical Association, a very big journal. And you can just kind of see how breast cancer 4 and 5 in the groups. There was no significant difference. People in that study, in their little study group, developed breast cancer during the first year. During the second year of supplementation, the supplemented group had 12 that developed a cancer of some kind in the population, but 18 in the placebo group. As it went on, if you looked at 1 and 4, the difference was even a little bit bigger, so all 4 years. So you can see that it can prevent, or at least sort of slow the development of cancers in women. And you can kind of see the graph here over time. The population, the placebo, this top line of people developing cancer, and the bottom line, the ones with vitamin D and calcium. And you can see by the time they got to the end, this was really starting to spread out. There was getting to be a big difference in those groups. It took a while to see the effect of vitamin D. It wasn't overnight, but it was very profound by the end of the study, which was only 4 years, which is not that long for this kind of a study, actually. And just looking at that, you can see that it looks like this is just about to flatten out. Well, that's still taking off. So if this had gone out to another 4 or 5 years, you know, I think we'd even have seen bigger differences in its ability to prevent cancer. How would it do that is the next question. And there's a lot we don't know about that. These studies don't tell you why it does it or how it does it. But we do know one thing. Cancer is attacked by the body by T cells in the body. These are immune cells that will go after your own cells, the killer T cells they call them, that have something wrong with them. So they identify your own body cells that have a defect. Well, cancer is a defect of your own cells. They've become changed in a way that's very bad. So the T cells have to seek them out, identify them as bad cells, and kill them essentially. Well, it turns out when T cells are exposed to antigens, something that will activate them and set them off as a target, activation of the T cell begins. The next step is for the vitamin D receptors to be expressed on the cell surface. Okay, so these vitamin D receptors are expressed on the surface of those T cells, cells. And then the receptor binds to vitamin D in the blood. The T cell, helper and killer T cells, then activate and produce more of the specific T cells that are directed against that antigen. However, if the receptor on that T cell doesn't find vitamin D in the blood to activate it, it's not going to do its job. And that's a very likely mechanism by which it might be protecting against cancer. You have to have if you're way, way down there in your blood levels of vitamin D, it's going to be harder for those T cells to bind to the receptors to vitamin D on the T cells, to find that vitamin D to bind to become fully active. So your own body defenses require that you have vitamin D in the blood to activate their targeting of the cancer cells. So that's the mechanism that I feel like is probably correct. We don't know for sure, but it's a very good theory anyway. Now, this was a really interesting study to me. I'm interested in diabetes. I'd like to do research on diabetes and obesity. This study was a prospective study. They actually followed 903 subjects for 12 years, so it was a long study. At the beginning, none of these subjects were diabetic or pre-diabetic. So they were all okay for diabetes. The average age was 74 of the subjects. So they were starting with an older population. So we don't know if this applies equally well to young people or not. But at the end of the study, they looked at, who got diabetes, who did not get diabetes, and looked at their vitamin D levels. It turns out subjects with serum vitamin D less than 30 nanograms per milliliter, so deficient by our definition and most people's definition, were 5 times more likely to develop diabetes than somebody with serum vitamin D levels over 50 nanograms per milliliter. I mean, they had a risk factor of what you call 0.19 actually. So it was actually a little bit less than 1/5 is likely to get it if you had the high levels of vitamin D. Now that's a huge difference. You almost never see that kind of difference in these studies. So that was pretty amazing to me. Also, they did notice as well that during the time of the study, they started out with a older group of people. 241 subjects died during that study, so for what, a fourth or so of the population of that study died over the course of the study, but they were starting at 74 years old and it went for 12 years. So you expect to lose some during that period of time. But of those who died, an average vitamin D level was 39 nanograms per milliliter, so okay actually. But those who lived had an average of 43 nanograms per milliliter. So it seemed to be protective from dying as well. But the diabetes was a really big thing. It was just hugely protective against vitamin D, having your levels up there over 50 nanograms per milliliter. So that's well above the threshold for being okay with vitamin D. And I'm not that high either. So it really can be pretty difficult to get up in that range sometimes. And we'll talk about coming up why that is. This study sort of starts with that. Vitamin D, the importance of vitamin D for weight, the importance of body weight for the dose-response relationship of oral vitamin D supplementation. This is in the journal PLOS One. You can read it for free if you go to these. In fact, I think every one of these papers I mentioned today you can access on the internet for free. So go back and look for them if you want to read them more carefully. But in this paper, it was actually done by some of the really top vitamin D researchers in the world. So it's a very good pedigree, so to speak, for this paper. And it's kind of interesting. The Institute of Medicine, which is the organization in the United States that sets the recommended dietary allowances, they give only one dose for everyone of vitamin D, what they should take, the RDA, for any age group. The Endocrine Society, the research group studies endocrinology, actually doesn't do it quite like that. They give doses that are adjusted for body weight, assuming that you need more vitamin D if you're overweight. And they're correct. Now, in their defense, the Institute of Medicine, they're in a little bit different position. They have to make recommendations in RDA, and trying to make them for all the different body weights is not easy to do on a on a food label or a supplement label. So I understand them wanting to have one average value for vitamin D supplementation, RDAs. That makes sense. However, it's not scientifically the ideal way to do it. And what this study found was that people who are overweight, that's a BMI of 25 to 29 basically, if you're an American. If you're in that overweight range, you should take about 1.5 times as much as somebody that's below that. If you are obese, and that's a BMI of 30 plus, then you should take about 2 to 3 times as much vitamin D as somebody who's leaner. So the weight really does make a big difference. Now, this is one of the graphs in their study, and I really like the way they did the graph because it really illustrates well some of the pitfalls of vitamin D. You'll look at the beginning of the study, and nobody was taking a supplement over here. Well, I put this in. This is 75 nanomoles per liter. I told you that's how they'll do it in the scientific studies, or that would be equivalent to 30 nanograms per milliliter. So that's why I put it this way. You can see kind of the reddish area there. That's the bad area to be in. The average person started out in the bad area in that study, okay? And then they gave them supplements over time. And you can see that the curve went up. They all got higher vitamin D levels over time. Now, you will notice a couple of things here. This is 5,000. Nobody got up into a therapeutic range with 5,000 IUs per day. You had to get past that. In fact, you had to get up to about probably 8,000 or 9,000 IUs a day before you could get up into what they call a therapeutic range. So, 5,000 IUs, everybody was in a safe range. However, even at 5,000 IUs, everybody was not in ideal range. You'll see that a lot of people down here at 5, even 10, actually over here, over about 18,000, somebody was still not up there. They just couldn't get their vitamin D up. So this is telling you something. These scatter graphs are really nice when they do it. That's what that kind of graph is called. If you just look at this, you don't get the whole picture. And most of the studies do it that way. You just see the mean value and say, well, everybody's okay by the time they get to probably about 2,000 IU. You've got, everybody's okay because they see this only. But you still see a lot of people that aren't okay when you see the individual dots. So the means don't always tell you everything. A person is not an average. So everybody is a unique person. But this, when I see a graph like this, when you see it taking off and then begin to level off, you're beginning to see that probably you're not going to get nearly as much benefit up here because it's not going to increase much with taking a lot more of it. It's going to increase very slowly. That's sort of a clue that you may not be wanting to get into that high of a range. The ideal range would probably be right about in here where the graph is still, going up but doing it. And here we see between 5,000 and 10,000 for most of these people was a good range to be in for their vitamin D, optimal vitamin D. So that's giving you a clue of how much an average person might need. There again, you are not an average person. Everybody's different. And I really encourage people, if they are going to the doctor and getting blood work done, really, ask them to check your vitamin D, your 25 hydroxy D3. Now, there's also the 125 hydroxy D3, but that one doesn't tell you much about status. That's just kind of an active form, and it really tells you more about kidney function in a way. So that doesn't tell you your status. You want the 25 hydroxy D3, and that's what most of them nowadays will do. But there are exceptions to that. But you can see from this that it's really difficult to say what is right for everybody. If I tell you that you should probably take 5,000 IUs a day, I'm just guessing. That's really good for some people. Some people do very well at 2,000 though, and get up here in a pretty decent range with that much. So it's really something that I would say if you're not going to get your vitamin D checked, 2 to 5,000 a day. And if you're out in the sun during the summer, on the lower end of that probably. During the winter, take more because you're not going to get the sun exposure and make vitamin D. But there again, back to this study, let's just talk for a minute some of the reasons why some of these people just couldn't get their vitamin D up. And we know the dark skin, the sunblock, not enough high-intensity sunlight, the excessive fat, these are all contributing to that, air pollution and age. So those are factors that can really be a major impairment to getting vitamin D up. But there's more, because there's things that will keep your supplement from working ideally as well. And here we see, remember we saw this once before in one of my talks. Dietary fat, your vitamin D is in the category of fats, and it's absorbed with other fats. So dietary fats go into the gut, they mix with proteins, they make an emulsion, and then the lipase acts on them to make them form these micelles. So you have to have fat, proteins, and your fat-soluble vitamins kind of all together in this emulsified solution, along with the pancreatic lipase, to make these micelles, and then you can absorb it, and it's released and absorbed in the gut wall. Now, there's some pitfalls there. First of all, if you don't take it with a meal, if you take your vitamin D supplement, say you get up in the morning, you pop your pills, drink some water, and go on, you're not going to get that vitamin D absorbed very well. That's a real problem with some people. And sometimes I have been known to do that. And, I'll be honest. I get up in the morning, I take my stuff and drink some water and head off to the gym. Well, I probably wasted that vitamin D, to be honest. So if I come back and eat later, it's probably too late. So it really needs to be taken with food that contains proteins and oils in order for it to be absorbed well. Also, people who are low in magnesium have a problem with absorbing vitamin D. And let's just go back to this one right here. This step right here, you see vitamin D comes in. We're showing it from sunlight here. It makes the 25-hydroxy vitamin D. That keeps it in the bloodstream. If it doesn't get made into the 25-hydroxy form here, then it's going to get lost and excreted. Now, the enzyme that makes that hydroxylation, makes this 25-hydroxy D3, is an magnesium-dependent enzyme. If you're deficient in magnesium, you're probably not going to make that well, and you may not get the benefit from your vitamin D. So there's another pitfall to both vitamin D from sunlight and from supplements. Obese people, we've seen that in the previous studies we mentioned. Sometimes supplements are not fully potent. Vitamin D is a very fragile vitamin compared to most vitamins, actually. And especially sunlight will really destroy it. So you want an opaque bottle. You don't want to put it in the windshield of your car. You want to keep it in, it doesn't have to be frozen or refrigerated, but in a cool, dark place, and it'll do a lot better. And get fairly fresh vitamin D. We make vitamin D at least 3 times a year here, so that we keep it fresh and going out all the time. That's not one I like to, something like minerals, your Cal-2, your magnesium citrate, they keep forever. You can't destroy them hardly. And so we can make a year's worth and not have any problem. You will have this fully potent supplement. Vitamin D is not so certain. So we like to make it fairly often. Keep it fresh. Make sure you're getting what you're buying. But, if it sits around too long, you're going to lose it. If you pick up a bottle that you bought 4 years ago, Well, you probably have some vitamin D there, but I wouldn't count on having anywhere near the full amount. Not supplementing enough. You know, the RDAs have gone from 400 to 800 to 1,000 to back and forth. They keep changing them for that. Well, they're all too low for most people, to be honest. So most people look at that. They take their multivitamin with 400 in it or something. That helps some, but that's not going to get it for a lot of people. The wrong type of vitamin D, that goes back to the D2, especially if they think they're getting it from that. You know, well, you need twice as much of the D2. You can get vitamin D activity from D2, but you've got to take a lot more of it. And then poor digestion. Some people don't do all that process of making those micelles and things. They don't have a good functioning pancreas. They don't make the pancreatic lipase, which is essential for making those micelles. So those people are going to have a lot harder time absorbing it. They're going to have to take a lot more. So there are lots of pitfalls to getting adequate vitamin D in the body. And those are things you have to consider. Now, we make vitamin D in two dosages. This one is the 1,000 IU, and this one is the 5,000 IU. Both are very good, high-quality vitamin Ds. Personally, I take 2 of these a day during the summer. During the winter, I take 1 of those a day. I might ought to, up that actually. If I'm trying to be more careful about my vitamin D and taking it with meals and fats and things, because I was really surprised the last time I got my blood work done that I was only about 31 or 32 nanograms per milliliter in my blood, and I'm taking all this vitamin D, 5,000 units every day. So, yeah, it may be the way I was taking it, to be honest. I may not have been taking it with fat and proteins often enough. I may have been doing my slam dunk the vitamins before I go to the gym every morning and I'm shooting myself in the foot that way. So that's what I'm guessing. We also have vitamin D for kids in this Beta Kids product. It has beta glucan and vitamin D. It's an immune formula primarily, but it's good for a lot of things. Wonderful product for kids. So I would strongly encourage you, if you have children, especially when it comes next fall, when they're starting to go to school, wonderful product for the children. And I appreciate your attention. I hope you've learned something today. And I know that I've learned something in preparing the talk. I always learn something from preparing talks. It's great for me. But I enjoy being with you. We'll have this up and going soon. If you haven't looked at our other talks, look at them. They really have good information. And so long for now. If there are any questions, I'll be glad to answer them. Okay, we have no questions today. So I'm signing off. And until next month, have a wonderful spring. Next month, I'm going to see, I might have somebody else talk next month. We'll see. I'm not sure yet. But I'm really wanting to concentrate on my research on the microbiome. And hopefully in the next few months, I'll have something really great for you on that. But I'm signing off now, and we'll see you next time. Thank you.